is Victoria Alexander, and I am the Older Adults Program Coordinator at Syntero. Today, I'd like to talk a little bit about how sleep affects our mood throughout the day and how we feel. As we know, the mind-body connection is very strong, and this is a classic example of part of our wellness. So our daily routines, including what we eat and what we drink, the medications we take, how we schedule our day, and how we choose to spend our evenings can significantly impact our quality of sleep. And usually, even just making a few slight adjustments can make the difference between a sound sleep or a restless night. So you might have heard the term sleep hygiene. And sleep hygiene is what we use to describe our healthy sleep habits and rituals that can help our ability to fall asleep and stay asleep. Cognitive behavioral therapy is certainly a big part of it. Cognitive behavioral therapy can help us address the thoughts and behaviors that prevent us from sleeping well sometimes. It does encompass different techniques for stress reduction, relaxation, and sleep schedules management. So if you're having difficulty with sleeping or staying asleep, or you want to improve your sleep, there are many things you can try to help reinforce healthy sleeping habits. If the problem starts to be a pattern, definitely consult your doctor, and you can see a sleep specialist for further evaluation and exploration and treatment of the sleeping issues. I'd like to share with you some helpful tips sometimes to encourage good, healthy sleep habits. One being, keep a consistent sleep schedule. Try to get up at the same time every day and go to bed at about the same time, even on weekends or during vacations. Don't go to bed unless you are sleepy. Make sure you go to bed when you're able to get at least 7 hours of sleep. If you go to bed and you don't fall asleep after about 20 minutes, do get out of bed, and by switching up your environment, that will help not make an association between getting maybe potentially frustrated with not falling asleep while you're still in bed. So if you leave the room, maybe you can read a book if you enjoy reading, listen to some calming music, maybe do a guided meditation, just something to kind of switch up the environment, because you don't want to, as I said, start getting frustrated by you're lying there and you're trying to fall asleep. So it can be a little paradoxical and work against you. Establishing a relaxing bedtime routine will help get you in the mind frame and get you ready for bed, and your body and your mind will associate, oh, these are the things I do before I go to sleep. I like to have a cup of mint tea. I like herbal tea before I go to sleep, something that does not have caffeine in it. And that's one of the cues that I think my body takes, like, oh, it's going to be bedtime here. Don't use your bed to do, research or work, anything that's not calming and associated with actually going to sleep. You should use your bed only for sleep and for sex. Make sure your bedroom is quiet and relaxing. Keep it at a comfortable and cool temperature. We've done a lot of research, and the research shows that we do sleep more soundly when the room is not very hot. So however you find it to be comfortable. Some folks like it a little colder than others. So it's up to you and your preference. You want to reduce the exposure to bright light in the evening before you go to bed, and that includes blue light. So turn off your cell phone and don't watch TV at least 30 minutes, preferably longer, before you go to sleep, because that blue light is very activating for your brain, and it can be hard to be quiet. It can be hard to get sleepy if you're looking at a blue screen. Avoid eating a large meal before bedtime. If you're hungry, go ahead and eat a light, healthy snack. But try not to eat a big meal right before going to bed. By exercising regularly in accordance to what you can do, that will help you get tired at night and sleep more soundly. And have a certain cutoff time for consuming caffeine in the late afternoon or evening. So that time is going to be different depending on how your body responds to caffeine. Also, avoid consuming alcohol before bedtime because that can disrupt your sleeping patterns also, and reduce your overall fluid intake before bedtime. Insomnia is actually the most common sleep complaint that the average person has. And insomnia means that you have trouble falling asleep or staying asleep, even though you have the opportunity to actually get a full night of sleep. So the symptoms vary from person to person, and it can be either it's hard to fall asleep, or it's hard to stay asleep throughout the night, or it means that you're waking up too early in the morning. So this can mean a variety of different things. And about a third of adults at any given time are complaining of having insomnia. Of course, everyone has the occasional night of forced sleep due to life circumstances or what might be going on with us. That doesn't mean you have insomnia. We're talking about if this becomes a pattern and lasts for up to 3 months. If it goes beyond that, you will definitely want to consult with a sleep specialist and investigate a little closer as to what might be occurring. Chronic insomnia can last at least 3 times per week and last beyond 3 months, and about 10% of people have chronic insomnia. You really should invest in a good quality mattress and bedding, since you do spend about a third of your life on it. So do what you can for that. One of the major causes of having a sleep disorder is certainly circumstantial stress in your life circumstances. There could be minor things going on, work or personal stress, maybe even more severe changes going on in your life, such as death of a loved one, divorce, or maybe job loss. Other sleep disorders can certainly make insomnia worse. Some people have restless leg syndrome, and this can make it to be hard to fall asleep. There are certainly also many physical illnesses that can bring on insomnia. If someone is experiencing pain or have limited mobility from medical problems, they might have a difficult time falling asleep or staying asleep. Also, insomnia due to medical conditions is more common in older adults because people tend to have more chronic health problems as they age. But we can certainly do things about it. So again, please do consult your physician if you're noticing this as an issue. In combination with therapy and taking care of yourself and using these bedtime routines, it can really make a big difference. There is a relationship between sleep and emotional and mental wellness. So insomnia is sometimes caused by a mental health disorder. And then oftentimes, if there is a clinical threshold diagnosis going on, insomnia can also be co-occurring. So depression is one of the most common mental illnesses in America, and certainly a frequent cause of insomnia. People with depression often find themselves having a hard time falling asleep or staying asleep. And also, difficulty falling asleep is common in people with anxiety disorders. Also, folks with a bipolar disorder diagnosis can also have sleep problems. Insomnia can be an unwanted side effect for many prescription or over-the-counter medications. Even common cold and allergy medications can make it difficult to fall asleep as one is adjusting to maybe a new antidepressant or medication to treat ADHD, blood pressure, or Parkinson's. It can have an effect on their sleeping pattern. Environmental factors is definitely a huge impact on sleeping. Being exposed to noise, light, or extreme temperatures will interfere with sleep. So again, set up your sleeping area to be comfortable and cozy for you. Sleep apnea is definitely a serious sleep disorder that you would want to have evaluated for if you suspect that you might have it. And it's when the airway becomes blocked and limits the amount of air that actually goes to your lungs. So a lot of times when someone has sleep apnea, if they do have a bed partner, they might say they are snoring or even making choking noises as they breathe. So because the brain and body is becoming oxygen deprived, this might happen anywhere from a few times a night or even several hundred times a night, depending on how severe the case is. So this is definitely a condition in which it's very treatable, but it does need to be evaluated. Someone might notice that during the day they might feel very fatigued, feeling unrefreshed, even though they thought they had a full night's sleep. And they might even be falling asleep during activities during the day. So long-term consequences of this can include high blood pressure, heart disease, stroke, diabetes, and depression. So getting evaluated for that can be very helpful. And there are many treatment options. There are some people that are called long sleepers, and they actually regularly sleep more than the average member of their age group. And they might find themselves ever since childhood that their nightly length of sleep actually tends to be 10 to 12 hours, but their sleep quality is still normal and of good quality. They just sleep longer than what most people need. Most people need about 7 to 8 hours. And that's not actually, it's not necessarily a bad thing. It's just their pattern is that they need more sleep. So sleep specialists right now are not considering that to be an issue. Again, there is a bi-directional relationship between depression and sleep issues. Poor sleep can contribute to the development of depression, and then having depression makes a person more likely to develop sleep issues. It can be a complex relationship and challenging to know which came first, but we do know that both co-occur. Insomnia is experienced in about 75% of adults with depression. And it's estimated, they're still looking into it and researching, but about 20% of people with depression might have obstructive sleep apnea, and 15% have hypersomnia. So if you can write a sleep diary for 2 weeks, you can track what changes you might be noticing, what you're observing in your sleep schedules, and this can be very helpful information to share with your provider and your physician. Sleep issues can also contribute to the development of depression through changes in the function of the neurotransmitter serotonin, and it can affect the body's stress system, disrupting the circadian rhythms and, again, increasing the risk of depression. Oftentimes, as folks get major depression treated and they're working on it, they often they report improved quality of their sleep. Counseling is a wonderful tool to help with issues in this regard, and exploring different medications can be helpful. We've also found that people that have been diagnosed with clinical levels of depression have decreased REM sleep latency and prolonged REM sleep periods earlier in the night than on average. So this can have an overall increase in the production of REM sleep, and they have more frequent rapid eye movements in REM than the average person. So that was really an interesting find.
Hi everyone, I'm Kristen Suarez and I'm an older adults clinician with Syntero. I provide mental health therapy services to SourcePoint's clients in Delaware County. Today I will talk to you briefly about navigating some of the changes we're facing in our lives today as a result of the COVID-19 pandemic. It has been nearly 7 months now since all of our lives throughout the world have changed. Globally, nationally, and within our own families, we are experiencing change, separation, and uncertainty. We have faced shortages of necessities. We have had to worry if we have the virus. We've had to worry if we could have potentially been exposed to the virus and what that could mean for our health. We've had to cancel events that mean a lot to us, birthday parties, graduation parties, births of babies in our family, funerals even. We've had to delay meeting new babies in our family, being able to go visit relatives. And even nursing home residents, they haven't been able to hug or even see their families face to face for almost 7 months now. So with all these major changes, most of us are either knowingly or unknowingly walking around in some sort of state of chronic stress. Our bodies and our minds have not been able to relax due to just the uncertainty of our world today. And older adults in particular have had to adapt to a lot of changes and a lot of technology changes. Telehealth appointments, having to use FaceTime to see loved ones, having to scan their phone at restaurants to see menus, online shopping, and grocery delivery. So a lot of things that people are having to learn quickly. So this can be extremely difficult to navigate or almost impossible depending on your access to technology. If you don't have anyone to help you learn it, if you don't have the money for a smartphone or a tablet, all these things can make it really hard to navigate the world today. So for those of you that do have access to a smartphone or other sort of internet device, you might have already figured out how to use FaceTime, but some of you might be a little bit more apprehensive and maybe haven't used it yet. So FaceTime, I will briefly go over how to use that. That FaceTime specifically is a very popular form of technology. It's helping people stay connected the best we can. And it's specifically for people with Apple devices. So you have to have an iPhone or an iPad in order to use FaceTime. Android phones, different brands of tablets, Facebook, they all have their own form of video messaging. But this is specifically for the iPhone. So if you have an iPhone, the first thing you're going to do is you're going to go to your contact list. You're going to select who you'd like to make the call to. So you select the person, and this is just an example I pulled off the internet, and it might be mirrored because of the camera. So basically, you have this sort of situation, your loved one's name, and different options right here. So we have messaging, it says iPhone, like calling, FaceTime, email, and pay. So in order to FaceTime this person, you just click the FaceTime button, and it's going to start an audio and visual phone call to that person. With an iPad, it's a little bit different. So on your iPad, this will be bright green, but it's basically a cartoon picture of a camera, like a video camera. So you're going to see this on the home screen of your iPad. You're going to click on this video camera, and then on there, it'll either have your contacts already loaded, maybe people you've already called, or there'll be a plus sign. So click on the plus sign, select who you'd like to call, or type in their name, and then you just click the video camera again, and that'll start the phone call there. So something new, I know some of you probably maybe already been using FaceTime for a while, but something new is actually at restaurants, a lot of them don't have paper menus right now. So you go to sit down at the restaurant, and what you have is this weird looking code. So it kind of looks like this, sitting there at the table. So this is called a QR code, okay? So what you do in order to see the restaurant menu, you will take your phone, and every phone is different, but you open up your camera. So camera like that, open it up. It might be a little different on your phone. So you open up your camera, and this will be much smaller likely at the restaurant. And you point your camera at this. Just have your camera just sitting. Don't take a picture, don't do anything. Just have it resting on this and it'll actually just pop up a link that says, would you like to go to this link? And you click yes, you just click on the button on the link, and it will take you to the restaurant's website that has their menu. And that's just the way for them to not have people touching reusable menus, and also to save on cost. The paper menus are kind of expensive. So you might notice that one. So now you know how to do that. One quick thing about this QR code. Sometimes you have to download an app on your phone in order for this to work. So if that's the case, you go to your app store on your phone, type in QR Reader. Type that in. There'll be a few options that pop up. Just select probably the first one, or whichever one seems like a lot of people are using or have rated positive, and download it, and then that's going to work the next time you try it. So very simple, but obviously something that we have to learn how to use. But all these things are a great way to get a little bit more personal interaction, and I think that's important right now. So we've been going through a lot of changes in our society during this pandemic, and some of them don't really even involve technology. We've had to start wearing masks in public, be more observant of our social distancing, of our cleanliness, and just kind of rely more on curbside pickup, grocery pickup, trying to kind of navigate this new world that we're living in. So every day we're getting new information, and it can get really overwhelming. So some of us, for example, are used to eating in restaurants and don't really do much of the takeout sort of thing. So we're aware of how to tip when we go to eat at a restaurant. So those of us now that are doing more curbside pickup or takeout may not really know what's the proper way to tip. So tipping is obviously based on personal choice, based on a lot of factors really. But right now the restaurant industry is struggling tremendously. And I know a lot of us, we really value our local restaurants. We really, the service that they provide to the community, help grow the community. So while tipping is customarily lower for takeout than for dine-in, many feel that right now during the pandemic, tipping for takeout and curbside should also be 15 to 20%. So the reasoning behind this is to show our appreciation for our servers, our business owners, our cooks who are putting themselves at risk to keep the restaurants open, and also for the workers and business owners just to try to keep them stay afloat during this time to keep our local economy going. So I understand that it can be difficult to come up with the extra money for all these delivery fees and shipping and tipping and all this stuff right now. So some of our businesses do recognize this, and they want to keep it safe and still let us get their service. So some of these businesses are waiving shipping fees, they're waiving delivery fees. Kroger is one of them. So their click list, which is when you order your food online and then you drive over there and they load your car with your groceries, they're waiving the charge for that service right now. And they also don't accept tips. So that would be a free service. And then many restaurants throughout the pandemic have offered free delivery, which this varies. So you want to, either look it up online or call the restaurant and see what special they're running. But different restaurants like Chipotle, Jersey Mike's, McDonald's, KFC, several others have offered free deliveries at some point during this pandemic. So it can also be just very difficult to be in the know, to know what the latest is, to navigate all these changes, navigate what services are out there, what resources are out there. So I definitely encourage you to reach out to SourcePoint and reach out to Helpline of Delaware and Monroe counties. They're great ways to get connected to resources, to know about new services. It's great if you're feeling overwhelmed, you need more services or resources, or just need information about what's going on. So we're all in this together. I encourage you to reach out to your friends, your family, caseworkers, healthcare team, social groups, support people, anyone you have in your life to help navigate you through this difficult time. But I thank you for your time, and I wish all of you the best.
Hi, my name is Anita Gearhart. I'm an outreach clinician with the SourcePoint Syntero mental health program. I'm going to talk today a little bit about emotional health. Emotional health is just as important, if not more important in some cases, as physical health. They both certainly impact each other. Many of us know that to be healthy physically, we need to eat nutritious food, we need to exercise, we need to sleep well, and that's no surprise. But to be healthy emotionally, those same exact things are needed along with other things, but they are very important to our emotional health. I'm sure we can all think of a time when our physical health impacted our emotional health and vice versa. They are kind of like a couple that they work better together rather than against each other. So it's better if they're kind of connected. If we know eating well, sleeping well, moving more is good for us physically and emotionally, what can we do emotionally that helps our physical health? Well, I'm glad you asked. Have you ever been frightened and you could actually feel or see physical signs of that fear, that emotion of being frightened? Maybe your hands were shaking, your heart was racing, maybe you were breathing faster. These are all signs of the fight or flight response. Your body is trying to determine if you stay and fight or if you run fast away. This is a great example of your physical and emotional self working together to keep you safe. Your fear emotion signals your body that you may be in danger, and then your body gets to work to prepare for a battle or a fast run. So if an emotion can signal our bodies into action to help us physically, can something physically act to help us emotionally? Well, yes, it can. If we're feeling fear because we're worrying something may happen to us or a loved one, we can use the physical act of deep belly breathing to slow our breathing, slow our heart rate, and calm us. Just like when we're afraid, our body takes over to prepare us to fight or run. This, if we have the fear and there's no imminent danger, then we can use a physical act such as breathing deeply to help us calm down emotionally. So, for instance, I use a breathing technique. It's nothing fancy. It's just called 4 by 4 by 4. And that's just breathing in through your mouth deeply, slowly for 4 seconds, holding it for 4 seconds, and then slowly breathing it out through your lips, like you're blowing up a balloon or something. There's nothing magical about the 4 seconds. If you want to do 3 by 3 by 3, that's absolutely fine. If you want to do 5 by 5 by 5, that's fine too. It's just easy for me to remember 4 by 4 by 4. And that's just what I say, but there's nothing magical in that. So you do whatever you feel comfortable with. Sometimes breathing in is difficult for people. Sometimes holding it for any length of time is difficult. So whatever helps you breathe in slowly, hold it, and breathe out is what you need to focus on. So why don't we just try that right now with just a gentle, deep breath in with me. Just kind of go. Can you feel that? Does that kind of calm you? So doing this about 3 or 4 times in a setting really does calm you and recenter you into not feeling so scattered and so fearful. So I would just encourage you to do that various times throughout your day. Even when you're not feeling stressed, it still has the good benefits. Something else physical that we can do, like take a walk, or maybe do some chair stretches or chair yoga. There's many videos. I know SourcePoint has had in the past some exercise videos and yoga online. Exercising and moving our body is very important. It kind of helps us get rid of some nervous energy. Listening to music can also lift our mood. If we listen to music and we enjoy it and it makes us maybe smile, maybe move around a little bit, that's a 2-for-1, moving and listening to music. Maybe we sit outside or take a walk to enjoy some beautiful scenery. Right now, it's a really good time with fall coming on. It's not too cold, it's not too hot, and it might be a very enjoyable time. These are all ways we're using our senses. We're looking around us, using our vision and hearing, listening to music, or maybe we can even listen to the crunching of leaves and the birds and all the sounds out in nature. Breathing, using our physical body and moving. These all help us emotionally. They're really simple. You don't need to have any special equipment. Sometimes you can't get out in nature. Maybe you don't have a way to get out, and you maybe don't have a good view out your window. Maybe you have a wonderful place that you could go to as you imagine that. Someplace maybe you used to go that you loved, or something that just takes you in your imagination to a great place of calm and peacefulness. Another important aspect of emotional health is to interact with each other. We are a part of a group of people that need each other. I know some of us are introverts, some of us are extroverts, but in essence, we all need one another. We need to be interacting with one another. We weren't meant to do this life alone. And so I know these times are strange and our world feels upside down, but with COVID and all the restrictions, but calling a friend or meeting a friend in your driveway to sit in a chair, socially distanced, or just any way you can connect with friends and family is vitally important to your emotional health. Isolation does nothing but breed loneliness and sorrow. Even if you're an introvert, you still need connection and interaction with other people. There are lots of stresses on us, especially now during this pandemic time, and we're all feeling some level of stress and confusion and fear, and we will get through this and we will survive. It may not feel like it on some days, but hang in. And just remember as we close to our emotions have a purpose. Try to be aware of your emotions and what you're feeling emotionally and physically. If you're hurt because of an action of someone else, identify it. And this is just to yourself, but say, that really hurt me. If someone did something that made you feel really special, and you can say to yourself, wow, that was really nice. I feel valued. It isn't always easy to identify emotions we're feeling, but the more you do it, the easier it gets, and the more in touch you'll be with your feelings and your emotional self, which in turn helps you to be healthier emotionally. Stay well and be kind to yourself emotionally and physically.